I took the COVID-19 vaccine.
I collected my first dose today.
I took my first vaccination of COVID-19 today.
I just felt it was time
to prevent myself from catching the virus.
Hi, my name is Ekpademe Umo, a BBC Media Action producer and presenter. I want to share with you some success stories that have emerged from the implementation of the Addressing COVID-19 Vaccine Hesitancy in Nigeria project, funded by the Bill and Melinda Gates Foundation.
When the project started in November 2021, the percentage of Nigerians fully vaccinated against COVID-19 was 2.8%. Today, it's 42.9%.
We are not saying we did all of it, but we definitely played a part in that shift.
We created a unique branding called Do It for Love, which means get vaccinated for the love of self, for your loved ones, and for the larger society. And this branding was across all our production and training outputs, which were radio magazine programs, social media, public service announcements, and capacity strengthening activities.
Our radio shows in Hausa and English are still being broadcast on over 200 stations in Nigeria weekly. And it featured people sharing their COVID-19 experience and their vaccination stories.
Ronke Giwa Onofua, you're welcome to talk your own.
Thank you very much for having me. It was in 2020 when my sister said, okay, daddy's ill, and then she took him to the hospital. He was in the hospital for a couple of days, and we thought, okay, this will pass. And then they found out that he had COVID-19. It was shortly after that he died.
Sorry.
So that was very painful for me because I thought, wow, how? My dad was healthy enough, for his age, and stuff like that, but he was very, very...
It's okay. Sorry, calm down. Sorry.
This matter, it concern me, it concern you. Talk your own.
Social media activities included virtual town hall meetings. Here is the story of Ruth, who was convinced to take the vaccine after participating in one of our virtual town hall meetings.
The question has to do with people with underlying ailments. It has been a trending history that when people have underlying ailments, they feel if they take the jabs, they will either die or have one crisis or the other. I have underlying ailments that made me feel it was not necessary taking the jabs, but I had to beat my fears to take the jabs because when you're pursuing something bigger, you don't really give a hoot what it takes. You just go ahead and get it.
More power to you, Ruth. Ruth is a journalist with Hot FM Owerri, one of the 24 media partners on this project.
The capacity strengthening targets for this project was 336 program co-productions with 24 radio partners in 12 states of Nigeria. This number has already been surpassed. The capacity strengthening story started with thematic training in Abuja.
We discovered that some of our trainees were not only hesitant to take the COVID-19 vaccine, but they were also resistant. But all of that melted away as many of them got vaccinated on the last day of the training.
Earlier before the training, I was not having the intentions of doing the vaccine. But now with this training, I've been convinced because I was told that the vaccines are just immune boosters.
As an advocate, I'm a health producer. I present health programs also. So there is need for me, while I'm calling for people to take the vaccine, and I could not do that if I haven't taken the vaccine.
Afterwards, the training train moved to all the partner radio stations where we conducted in-station practical training. We also conducted radio town hall meeting training and co-productions. Many people got vaccinated after participating in those radio town hall meetings.
What even motivated me to actually get the vaccine is the fact that this town hall meeting reawakened my consciousness to the fact that COVID-19 still exists. So I decided to go for a shot.
What gingered me to collect this vaccination today from this town hall meeting that we did is because I had some preachings from our leaders, Imam and Pastor.
I just took my first dose and I'm hale and hearty. I'm fine.
I'm convinced a lot regarding the issues they have discussed during the course of the town hall meeting. And I happen to be encouraged and convinced. I collected my first dose today.
What impact do the training activities have? Better to hear it from the beneficiaries themselves.
Before now, I didn't believe in the whole COVID-19 vaccination and all of it. After the BBC Media Action Training, I realized that there are people who are dying who have died and still dying from COVID-19. And I also realized the importance of the vaccination.
The training has been engaging. Yes, engaging both physically, intellectually, mentally, and most importantly, it's helped me to, put into practice some of those things that I learned from the training.
It improved the intake of COVID-19 vaccine. Before, I think we are lagging behind in Plateau State, but now we are ahead of many states in terms of taking the vaccine of COVID-19. I have a strong belief that people take the vaccine in Plateau State because of our programs, with the help of the training that we gain from BBC Media Action.
BMGF project has been a success to me and my work entirely, because it has transformed almost everything. Even me myself, I feel much more comfortable, and I get so much commendations from friends and audience and so on.
I handle a health program, so it was quite difficult for me to, you know how health programs can be. People presume that it can be boring. Okay, the question that was always born inside of me was how? How can I make this program better? And when BBC Media Action facilitators came down here at Hot FM in Owerri, and they had that training, and I was happy that they were able to help me identify my how for my health show.
The impact of the training, for me has been enormous. So for COVID-19 especially, because I realized during the course of the training that, should I say, let me call it fatigue of information. So now I have to devise new ways to pass the information across that is entertaining, and people are ready to listen without even realizing that they are probably listening to a COVID-19 related topic.
Many thanks to BBC Media Action. They've been doing a fantastic job. The resource persons have been, absolutely wonderful, and they seem to understand their craft.
For instance, now we have the issue of COVID. And COVID, with all fairness, is a very difficult topic to handle on radio, and likewise any other platform. BBC Media Action has made it easier for them to understand that this is something we can talk about. We had a town hall on COVID, and then we are looking at why people are not accessing vaccine. We look at various angles, and then on the feedback on the people that said, okay, one of the guests in the show said from primary health care was saying, if I bring the COVID-19 vaccine, will people take it? And surprisingly, yes. 25 people took it immediately.
Even some of the staff were not ready to take it, but with this project, some of the staff who were not, did not take their vaccine in the first place took their vaccine.
We have brought a lot of behavioral change, particularly on the issue of COVID-19. The one we did recently is on the town hall meeting. This is the first time we have been learning on how to produce a program, particularly of the town hall meeting. Now we can produce the program perfectly without them interfering.
Our story isn't complete without talking about the partnership we had with the National Primary Healthcare Development Agency, NPHCDA.
Their contributions were immense, supporting our production and training activities.
To answer our questions, Dr. Basi Oposen, Director, Disease Control and Immunization at the National Primary Healthcare Development Agency.
Dr. Abdullahi Garba Bulama, daga hukumar NPHCDA.
So there you have it. Indeed, we did it for love on this project. So be like us in BBC Media Action. Do it for love.
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 Do it for love.